Hi everybody, please give me a few seconds to press this button. This is so incredibly important. These are things I literally didn't know, and you know we're always trying to research and find things out. But pay close attention to what she says. You can see what the subheadings are right here. And then I'm going to post this video as wide and far as I can. But this is so important for you out there that cannot figure out why your health is not getting better. So pay attention, please.
Dentist is the way we're trained, but I do agree with you. I think we're much too aggressive with dentistry, especially with children. Over 100,000 children a year undergo general anesthesia to get their teeth fixed.
Wow.
And I get a lot of second and third treatment opinions that come into me, and I have to be honest, it's some of the kids I feel like don't even have cavities. Like some of them just have watches, things that I would watch and try to remineralize, and they're told their child needs 8 root canals and 8 crowns. It's really common. So for anyone out there, I think it's reasonable to always get a second opinion. You know, I think if you go to 5 different dentists, you may get 5 different versions of what needs to happen in your mouth.
Yeah.
Try to find someone that works more biomimetically, more biologically, more functionally, is more conservative. So many
What I want you to hear is coming up. It's very important.
Like inlays or onlays, like much smaller puzzle pieces that can repair the tooth. There's conservative dentistry that can be done. You know, a drill is very aggressive. It creates microfractures in the tooth. It generates a lot of heat. It can damage the nerve. So maybe consider looking for a dentist that uses lasers. It's not only mercury. In pediatrics, they're still using something called formocreosol in root canals. It's formaldehyde, which is a known carcinogen. Yeah, and these substances, mercury, formocreosol, they've been banned in the EU. But so many dentists, they'll just say, well, it's always worked, and they'll stockpile these materials, and, you know, they just kind of, it's always worked in my hands, so why would I change it? You know, sort of the mentality.
Can you imagine that? This...
People ask me constantly, Dr. Axe,
keep listening.
Should I get a root canal, or I've had one, I'm having problems now? What is your opinion on root canals?
Yeah, this is a nuanced conversation. I do not like how it's become so black and white on media, because it's not. We're all bio-individual, and it's not really the root canal that's the issue. It's the way it's been performed. Okay, it's the technique that was used. And so many root canals are not done appropriately. I would say very, very few, you know. So if you have an existing root canal, the issue is a lot of bacteria, fungi, you know, parasites and things can live down in this kind of dead organ and create a lot of issues, you know, inflammation, potentially cancers. You know, there's a lot of research that's needed, but many people report when they get their infected root canal tooth out, they feel a lot better. A lot of their health issues improve. But I can't villainize every root canal, because I also think some are fine. And it has to do a lot with the host, too. You know, can your body handle this issue or not? You know, and we have to be evaluating root canals differently. So many dentists just look at your existing root canal tooth with a 2D image. Okay? You can miss so much on a regular x-ray. You need a 3D, like a CBCT. And we recommend, if you have had root canal teeth, you should be doing that probably every 3 to 5 years to ensure there's no missed periapical radiolucency is what we call it. It's basically an infection, chronic, low-grade infection that you may not feel down at the tip of your root.
Important point coming up here.
I have had patients over the years who came to me, and they had issues like major brain fog. I mean, that was one of the primary symptoms. I had somebody who thought they had MS. I had somebody who thought their issue was they had Lyme or another type of infection, and they went and they got their root canal fixed, and for some of them, their symptoms completely disappeared.
Yeah, I believe that.
Of brain fog, of fatigue, of all these things. And they are the symptoms. If somebody has like a Lyme disease or a major infection, that's the symptom they had because that area was infected because it wasn't done properly.
Correct. And what materials were used? Were they biomimetic? I mean, people are putting some pretty terrible substances down into these root canal teeth, you know, and it's improving. So I think my advice would be, this is the way I usually look at it. Are you symptomatic? Do you have brain fog? Do you think you have MS? Are you dealing with Lyme? I think you need to look at your root canal teeth. Absolutely.
Yeah.
Are you having weird skin rashes? Anything out of the ordinary and you have root canal teeth, examine those. If you have root canal teeth and you're thriving, just make sure someone's checking them regularly every 3 to 5 years. I think we forget there's an emotional attachment to our teeth too, especially anterior teeth. So if you've had trauma or something and you want to maintain your front teeth, and the only way to do that is a root canal, it's really hard for me to say
I hear you,
and to scare someone to say, no, you shouldn't do that.
This whole interview is amazing, so I'm going to share it. I felt like doing a live on this to reach you guys, because sometimes people don't look at these videos, and this one is just extremely, extremely important to look at our mouth. This whole interview talks about how, you know, we've been learning a lot about the gut-brain connection, right? Well, your gut starts in the mouth. So could it be that we have an underlying mouth issue with our teeth causing issues? They talk about everything I've had, like H. pylori. I had really bad candida. I've had some of these gum diseases. I've had my teeth pulled, and you guys saw the video where I was jerking all over. So I've had multiple infections in my mouth. So could it be that some of our issues, whether we have Lyme, MS, or other issues, could it be related? Could it be part of what's going on in our body that we're missing and fixing? And this dentist is amazing. They just did this interview with Dr. Axe, who I really, really like. So I'm going to post this video, and I hope that you will watch it, because this whole interview has stuff you didn't know. And can you imagine having formaldehyde in your mouth? And I always say it wrong, but you know what I'm talking about. So I love you, ladies. Thank you for watching, and I appreciate it. Please share. And I'm going to also try to get this to my YouTube channel. And always like and subscribe, because we're trying to make the world a better place and help just the common people get better and discover what's going on in their body. Things, you know, thinking outside the box. This is really outside the box, because this is some of the information that's never taught to us. I love you guys. Have a great day. Thank you for watching.